Thank you for the lovely introduction. So I would like to start by thanking Asia for Animals for letting me speak at this event. And I'm really happy because back in 2010, I attended the Asia for Animals conference in Singapore. And actually, I would say that was very inspiring for me in the field of animal welfare. And that's what drove me to, get into this field. So without further ado, I'm going to speak about the impact of worldwide veterinary service charities, Taskforce programs in India and internationally. Organization, Worldwide Veterinary Service, is an international charity focused on driving forward One Health and animal welfare agendas through sustainable veterinary capacity building. We have our international training centers in India, Malawi, Thailand, and in the Galapagos. So these are form a base from where an expert veterinary team with some of the veterinary assistants travel to different places, and they kind of network with governmental, non-governmental, and academic institutions. And they provide targeted direct engagement locally. And this is the basis of forming the WVS task force team. We are a small family right now, but growing. We have our CEO, Dr. Luke Gamble. We have Dr. James Hood, who's the International Director of Task Force. Then my colleagues, Dr. Amanda, Dr. Sumant, and me. We are focused on to train, to support, and to empower the entire animal welfare community, whether it be veterinarians, whether they're non-veterinarians, rescuers, feeders. So we include everyone in our outreach program. We actually, the task force, WS task force, was established in 2020, but because unfortunately due to the pandemic, we started a bit late, and we did our first project in April 2021. So I think it's been about 2.5 years, and we have done our outreaches in different states of India, as you can see. Internationally, for now, we have done two, one in Nepal and one in Egypt. So how do we plan a task force outreach? So this is basically, we are either approached by an NGO or a shelter which is interested in carrying out such a program. And we try to understand their motives and objectives, what they want to achieve. We make like a project proposal with them to try to understand what the organization can provide and what our organization, WVS, can provide. So we have like a mutual, agreed consumable list. Then planning and risk assessment is very important. Previously, due to COVID restrictions, we had to follow it quite strictly. Also, different countries have different rules, so we have to make sure all our risk assessment is done. And then once we are sure about the project, we go ahead and we advertise locally for participants. These participants are either vets who want to get trained in birth control surgeries, animal birth control surgeries, or they can be non-veterinarians who just want to like help as veterinary assistants when either surgeries are going on or medically. So then we get a list of participants who are interested. What we do first is we decide the nature of outreach. Now, some outreach projects can have all these different components that I'm going to talk about, or it can have either or of 2 or 3 components in the outreach program. So the first one is a 2-week animal birth control surgical training course. This is regularly carried out at our international centers all across. But this is a little different because we are going to the local place to kind of, train the vets over there locally. And this kind of has a lot of advantages. We'll talk about it later. Then there can also be just an ABC animal birth control surgery week or 2 weeks of it with intensive birth control surgeries happening. We can do some special surgeries. When we work with different rescues, they always have cases that need like, urgent amputations or need special surgery. So we also do that when we are visiting the shelter to help them. Then we can, like maybe on a weekend or something, during the course itself, during the project, we organize vaccination drives where we, along with the, entire group, go and vaccinate locally. We also spread awareness during that time. Also, the weekend is utilized to kind of do a one-day first aid and shelter management course for the non-veterinarians, quite interesting. And we also can visit colleges, veterinary colleges. We interact with the final year students or the internship students and try to explain to them about, humane dog population management and control. We try to make it a point to also visit the local municipality, because whenever you have like a shelter organization, is always important to have a good understanding and collaboration with the local municipality or the government institutions. So we try to visit and see if we can kind of give them some tips or just explain certain things to them in their ABC centers. That's the animal birth control centers. So, and the last is also rabies surveillance. We have a sister organization, which is Mission Rabies, working very hard to eradicate rabies. So we have we give a lot of importance to rabies surveillance and the diagnostics also. So it can either contain one of these, or it can be like a 1-month-long program locally where we include each and every aspect. And because it's really intensive, we know that it has to, everything has to be done within a month. So it is possible. Talking about each component, the spay and neuter training, surgical training. So the core of it is to have like a humane dog population control, where the welfare of the animal is going to be of major importance. It's a catch, neuter, vaccinate, release kind of a program. It is a high volume and high quality surgeries conducted during this program. And we also somehow try to minimize the post-op kenneling time. Quickly talking about that, the problem is sometimes if the surgeries, say, are not done in a particular way, if they're not done aseptically, the dogs or the animal's dog or cat might require a very long post-operative caring time, which again is negatively influencing the health of the animal. So we try to kind of make sure the surgeries are done really, really well, so that the animal can be healthy to be released as early as 4 to 5 days. So what this course also does is it imparts good surgical skills among vets, and it also teaches humane handling to the vet assistants, which can contribute positively. It develops confidence among vets to perform in low resource settings. So we have been to places, certain states of India, which don't have enough of infrastructure or resources, but we try to manage and we try to make the best out of those resources. And even there are sometimes we have to modify protocols, whether it's surgery or anesthetic protocols, according to the drugs available. So that is what we do, and we always try to maintain a very high quality of work wherever we do our outreach. Talking about anti-rabies vaccination, like you can see just the team that we are collaborating with, the organization, their team, the WVS team just, travel locally. They go and, spread awareness. They distribute literature about rabies, how not to get bitten by dogs, and if you get bitten, what to do, and things like that. So it kind of includes the community around. We also, when we are vaccinating them, we speak to them about sterilization programs that are happening in the NGO or the shelter nearby. So it's kind of an awareness drive also. Also, after we finish the surgical training for the vets, we sometimes try to run like a intensive 2-week sterilization camp where many surgeries could be done, and it is kind of again a training or a revision for the vets who have recently learned how to spay and neuter. It's done under supervision of the senior vets, so it is safe, and they get a hang of how in future they can conduct mass sterilization camps in their own areas or locations. And it's a good opportunity for them to watch also special surgeries or just learn new things about different kind of wound management and things. Like I said, during the weekends, we make use of it and run a first aid or shelter management workshop. This basically just gives information about do's and don'ts of first aid, treating trauma cases to people like volunteers or rescuers who are in close association with the NGO we are collaborating with. And shelter management is a very interesting but required subject that has to be taken up when you do such programs, because there are a lot of people opening new shelters or NGOs, but the basic things of how to manage the shelter and prevent overcrowding or just managing the capacity is not told to them. So then when they get overwhelmed, then it damages both the animals and the people who are running the NGO. So talking about general disinfection protocols or just separating, isolating sick animals, very, very important. That is what is delivered in this lectures. Then this is really close to me, because when we were in vet school, actually we didn't have a subject called shelter medicine or shelter management, and we are not taught that many things related to shelters. So when vets graduate, it's just normal to them to think that they have only few choices, either join the government services or do a private practice, or maybe just go to other countries, learn something else. But if we focus on this particular batch, which is going to freshly graduate, and they have a lot of options that what they want to do, if you kind of guide them into understanding what shelter medicine is and how they can contribute to the shelter and how they can help the actual animals who are in need, it I think really will influence them in a very positive way. So we try to sensitize the students towards humane dog population management and rabies control. Recently, we have collaborated with the International Veterinary Students Association of India, at least, and so we are kind of arranging programs for these veterinary students in colleges. So they visit our international training centers and see how we go about using our protocols for humane dog population management. Visiting the municipality, again, like I said, it's difficult to do this because they have to be a little accepting of someone coming to their, center to tell them like if something is wrong. Obviously, we try to be very diplomatic and we tell them in a very gentle way that maybe they could include more painkillers, or maybe they could, use some kind of anesthesia, which is more safer for the animals. If we get an opportunity, we demonstrate our spay and neuter surgeries so they can see if they can make a change in their protocols. And we just inform them about different multimodal analgesia, that's using multiple painkillers to actually make it pain-free, which also indirectly will reduce the post-operative complications or pain that the animal feels after surgery. Yeah, so rabies diagnosis and surveillance, a lot of dogs in India really suffer and die because of this deadly disease. And there are different things people are trying, and Mission Rabies being at its best. And they kind of rabies surveillance is more important, because if you don't know there is a problem, you actually won't work towards it. So that is lacking. A lot of surveillance needs to be done. Also, if they find a dog having the disease or having the signs, nobody notifies the disease. It being a notifiable disease, it has to be notified to the government, which is not done. Again, a denial to accept, like in certain countries, we saw that the government is actually it doesn't accept, or it denies that it has rabies in the country. Again, non-availability of vaccines is being taken care of. A lot of organizations are providing free rabies vaccinations, which is good. And we need organizations to also conduct vaccination drives. So when we visit our outreach, what we do is we have these lateral flow test kits similar to what we were getting in COVID. And we take a sample of the brain. Obviously, if the dog, this is done only post-mortem, and once the dog passes away or is showing signs and is euthanized, we demonstrate the use of this lateral flow test kits. And these test kits are really sensitive, around 98%. So this is done and shown to the vets so they can, carry forward this testing. Also, there is a proper method to collect data. You just cannot say, oh, it's positive and just note it down. You have to note down when it happened, how it happened, and how many people were exposed to this animal which was showing signs of rabies, and have they taken their post-exposure vaccine. So there's a database that has to be collected once you do the postmortem of a dog. Again, some governments or municipalities won't accept these tests as 100% guarantee that it was rabies. So what we do is we tell them about institutions which can do further testing, which is a direct fluorescent antibody, which is a higher test they do. And once that is positive, then there is no doubt about it. So these samples, unfortunately, they have to be sent a little far because all states in India don't have the labs. But we guide them about how to send it, and then they get the results. So rabies surveillance and diagnosis is also taken seriously during our outreaches. Yeah, so that was about the components. Now, just going through the different states or countries that we have been to. So, like we started in April, we went to Nepal. We collaborated with the 2 colleges in Nepal, and we trained the veterinary students over there. So, around 20 of them got trained in animal birth control surgeries, and they were really happy to get this opportunity because in vet school they don't get that much of exposure to do surgeries. So when they graduate, they are clueless, and these kind of surgery training courses kind of helps them further to think about dog population management also. Then we did it in Maharashtra with PAWS, Mr. Nilesh is the founder of, and it was a very intensive program. Also, we had to fight a lot of climate problems. There was a cyclone, and there was heat, and then there was no electricity. So this kind of gives us an idea and helps us to kind of change different protocols, and to help them also to kind of be prepared for the worst. So it was a good experience, and from this batch of training students, they also had vets who now regularly do surgeries at their shelter, which was quite good. Then in Egypt, yes, it was quite out of the way, but we were very happy that we did it there, and we were invited by an NGO called SNAP, and so the vets over there also, unfortunately in Egypt, because of the rules, there are not many strict rules regarding animal welfare, but we tried our best to at least have a safe sterilization program and to teach the vets how to use protocols. There were certain drugs which were not available, but then there were alternates that we suggested, and it was quite a successful training program. And we did find, again, few rabies positive dogs in Egypt also. Then we went to Assam. Again, a NGO was newly set up, and they wanted to start doing mass sterilizations. They were not very well equipped, so we kind of helped them with infrastructure and also trained them trained the vets in surgery. Then we did projects in Dharmasala and Ambala, just different states, and recently it was in Kolkata and Raipur. The last place that we did, Raipur, I would like to talk about it because it's really scary what's happening there, and we didn't expect to get so many rabies positive cases over there. We just went for like a animal birth control training surgery course, and every week we were getting 2 or 3 cases of rabies, the positive cases, and it's really shocking. And they are collecting data, but yet the government has to respond to this. They haven't yet done anything much. So we hope that the database and Mission Rabies can play an important role in helping the state of Raipur. So overall, we trained 80 veterinarians, vet assistants, reached out to more than 300 people through education seminars, 1,500 sterilization, 2,000 anti-rabies vaccinations. But again, more than numbers, the thing that we found important when we evaluated is the change in shelter protocols, asepsis during surgery, maintaining really clean environment when you're doing surgery, very important. Reduce the kenneling time, importance of isolating diseased animals. Then rabies diagnosis and surveillance has improved in places that we did our outreaches. And veterinarians, those who did the training course are volunteering and working with the shelters. Overall, achieving a humane dog population control method, and we raise awareness amongst animal rescuers and feeders. We have a WVS data collection app wherein a feedback can be sent, so all the participants who have attended or the founders of the NGOs and shelters, they have given us very positive feedback, and that's how we evaluate. We also keep in touch with them regularly to know how they are doing, and if they need any help, we're always ready. And the outreach, the main thing is that education and training and engaging the community will bring change. It's a very positive thing. So expanding Taskforce, we are going to go online. We're going to do some courses, which is already the pilot has been run for, trying to venture into disaster relief also, and expanding the team to Thailand and Africa. I would really like to thank all our donors, sponsors, and all the NGOs that have supported our work and collaborated with. A big thank you to them. I have a short video. I hope I can play it. Thank you.
Thank you, Dr. Anahita. And for those of you who has questions for Dr. Anahita, you may see her after the sessions today. Yeah,
Thank you. Saved me.
Thank you so much. All right.